Okay. All right. Hey, everyone. Welcome to Health by Heather Hirsch today. Of course, I'm Heather Hirsch, and I have my very good and patient friend, Dr. Natalie Dattilo, back with me today. We did a podcast, around the holidays, before the holidays, on gratitude. So Dr. Dattilo is back with us today. She is a director of psychology at Brigham and Women's Hospital, where I also work. And we are just going to have a very candid conversation about the essentially some of the self-care properties that Natalie's going to talk to us about that we want to think about as we're going through the pandemic and as this whole thing waxes and wanes. So Natalie, I'd love for you to just reintroduce yourself to everyone in my audience and what you really like to focus your time on, especially in your niche of psychology.
Hey, hi Heather. It's so good to see you again. This way, virtually at a distance, but closer than
Last
ever.
last time we were in my little office
I
and
know. Gosh, that
yeah,
feels like a
forever
lifetime
ago.
ago. Yeah. So I'm a clinical health psychologist and I work at Brigham and Women's in the Department of Psychiatry, and I see patients there primarily treating conditions like depression, anxiety, insomnia, stress, burnout, the stuff that we see a lot of and that everybody is a little maybe familiar with now, at this point,
Everyone's
having
got
all
like a
gone
finger
through
in
what
it.
we've gone through. Yeah, everybody, we've kind of dipped our toe in the anxiety pool a bit, if that was a first for some. It's been intense, that's for sure, and we've been working really, really hard for the past couple of months. And my my main areas of interest, I love working with people on mind-body approaches to health and wellness, both physical, mental, emotional health, wellness, and fitness, and like mindset strategies, motivation, and self-care, and the importance of self-care. And especially, lately, and kind of like always, but especially lately, and the self-care activities that we do really form the foundation of our ability to cope, and our ability to cope well, and our ability to adapt to changing situations and be flexible in our approach to do that, which is really what allows us to be resilient in the face of adversity and setback. So,
Wow, yeah. So let's talk about self-care.
okay.
So I was going to ask you why self-care is so important, but you sort of started to divulge a little bit about self-care. But let's really kind of get into that a little deeper because we all hear self-care. It's sort of like when the dentist tells us we should brush 2 times a day, and we do that for like a week, and then we fall back into like just brushing at night or whatever it is that your bad habit is, not, maybe I'm projecting. But why should we really think about the benefits of self-care? And then if that's so important, how do we keep that a habit?
hmm No, that's a really good question. And I think about self-care maybe just a little bit differently. There's actually a standard definition that the World Health Organization uses for self-care, and it really is intended to give people tools to take better care of their health themselves without always requiring a medical professional to be the one that's always sort of the go-to person to be taking care of our health, like putting that back on us and sort of empowering us to do what the best that we can to take care of ourselves, body, mind, spirit. And so I focus on like the psychological aspects of self-care and the things that we can do to enhance our mental fitness and our mental wellness, which is also connected to our physical fitness and our physical wellness, because the mind and body aren't separate from one another.
Mhm.
And my definition of self-care is actually really pretty simple and straightforward. It's those things that you know are good for you. Like when you have that go through your head, you're like, oh, it would be really good for me to do this. It would be good for me to do X, Y, and Z, or I know that this is good for me to do. And it's all the things that we basically already know. So it's exercise, it's nutrition, it's sleep, it's all of those things, and taking matters into your hands and really being very taking some ownership over that. But I'm also looking at the things that how we think, and being really careful about the things that we think and how we think about ourselves and how we think about the world, and really thinking and really making sure that we're paying special attention, and that there are tips and tricks that we can do that will help keep us healthy in mind as well.
Yeah, because I'm already thinking about those thoughts that run through people's minds, like, I should exercise, I should brush my teeth twice a day, I should go get that manicure, but and
Yeah.
so how do we allow ourselves to be able to
Mm-hmm.
give ourselves the real pleasure of being able to actually do those things? How do we change that mindset?
Right. And this idea that self-care is selfish. And although I think on one level we know that that's not true, that we, especially as mothers and as healers and as helpers, that we really need to take care of ourselves first. And we say that, but sometimes we end up paying a lot of lip service to that and not really translating that into action or making it a priority. And making it a priority every day. It can't be an afterthought or something that you schedule in once a month. It really needs to be something that you're paying attention to every single day. It doesn't have to be big, it doesn't have to be luxurious, and it doesn't have to be extravagant. It's the mindset and the intention behind the activities that you're doing that really make them self-care.
So it's more like even think about it on like a micro level, because hashtag self-care Sunday is sort of everywhere, right? And everyone's spending all day Sunday, and it's everywhere. It's in popular culture, but I kind of cringe. Like, self-care Sunday makes it feel so cringy to me, because it should be more than that, right?
Mm-hmm. I talk about radical self-care. I mean, it's like, it's like this idea that like you should be taking care of yourself every day, and to put, and I don't know if that's like, we should prioritize rest on Sunday, and we should always make sure that we're on that, on the list of things to do and take care of that day. But you're right. It's an everyday thing. We do things every day that we know are good for us to do. And it makes a difference when you recognize that that's what you're doing and that's why you're doing it. It
Mm-hmm.
enhances the benefit of whatever activity that you're doing when you bring your full attention to the activity, recognize it, and label it, in
Mm-hmm.
this case, as self-care.
So why do you think that particularly women tend to put themselves last and make self-care so low on the priority list?
I think there are a couple of reasons, and we could probably come up with some together, but there is this idea that putting our needs like ahead of others in our lives, like our children and our partners or our friends and family, is selfish. And I don't know if it's about putting our needs ahead of anybody else's needs. It's really about putting our needs on the list too. Just not being self-neglectful, which I think is where we go wrong. I think that's where we get it wrong, is that we have equated that idea with not doing it at all.
Mm-hmm.
And it's really just about making sure that we have carved out time for ourselves as well.
Mm-hmm. So, all right, let's get down to it. How much time does someone need for themselves every day?
Oh, that's a great question. Actually, I don't know. It's a good question though. I've had that. It's like, at what dose? At what dose do you
Uh-huh.
get a response, right?
Uh-huh. Yeah.
And I'd love to know the answer to that question. It's a great research study. We should do that. But I think, and the reason why we probably don't have a good answer for that is everybody's different,
Yeah.
right? And so everybody's needs are going to be different. And even in one individual, their needs are going to change over time or even day to day, just depending. So it really requires a person to have a good self-assessment and a good self-awareness so that they can be kind of constantly or on a regular basis checking in with themselves and how am I doing? What do I need? How am I doing? What do I need? How am I
Mm-hmm.
doing? What do I need? And like how much self-care, how much self-attention needs to be paid would be based on like the answer to that question. So it
Mm-hmm.
could vary. But
Mm-hmm.
at a minimum, I think even just a few minutes
Mm-hmm.
in recognition of yourself and sort of taking a time, even if it's just a few moments to breathe, that's self-care. In that moment, if that's what you need, if that's what you need and you're being responsive to that, then that counts as self-care.
Mm-hmm. Mm-hmm. Yeah. And I'm sort of taking that a step further. Sort of like everything else that we make a habit or we put into our lifestyle. I'm assuming the more that we do this, the more that we do this, right? And the more we sort of realize it's so good for us, it's okay to have either moments of self where we're just not taking care of someone else, or we talked a little bit about this before we started, where we're actually doing something like playing, and we can talk about what adult playing is.
Yeah.
It's probably not as sexy as it sounds. I guess it could
It could
be.
be.
But so is there, am I wrong to sort of think you've sort of formed this connection where when you do it more, you do it more?
Yes, absolutely. I think anything that we do more and make a habit and are deliberate and intentional about doing it, we get better at doing it, and it's self-generating. So we want to do it more. It becomes reinforcing and rewarding. And I think that's a really critical part, is that we want for it to feel good. We want for it to be enjoyable. We deserve that. And the brain needs to be reminded of what it feels like to feel good. And this is sort of what we were talking about before, which is especially during the past few months and even now, and kind of looking ahead, it's kind of difficult to look forward to things and to have things in our lives be enjoyable. There's stress and uncertainty and anxiety kind of looming all the time, and it almost feels like in some ways maybe even insensitive to be thinking about doing fun things right now when there's just so much strife and turbulence. And so, but the problem with that is that if we don't take the time and be intentional about also enjoying ourselves on a regular basis, if not a daily basis, then that part of the brain almost forgets how. And it's sort of like a muscle. It's sort of like when you stop working out a particular muscle, it doesn't go away. It just gets weaker and maybe a little atrophied over time. You can bring it back, you can build it back up by working it out, but you need to recognize that that isn't just something that happens to us, that we can cultivate an active practice of happiness, pleasure, play, and reward.
Yeah, I actually had an interesting conversation with someone who does sex counseling, and I'm drawing some parallels. And she had mentioned to me, and I'm sort of paraphrasing, but that we think that sexual activity is sort of always spontaneous. We see it in the
Right.
movies, and everything happens spontaneously, right? Or that fun is just spontaneous,
Yeah.
and we don't have to
It
do
happens upon
anything.
us and we just
Yeah,
experience it that way. So like
right, exactly. The circus just pulls up to your house. You're the winner,
delight.
and exactly. And so you're right. We do have to sort of, I'm seeing sort of some parallels. Sexual health, just happiness, and playing in general. Is that we might have to do some of that legwork where we start to plan for
Mhm.
those things and prepare for them, and then accept them and be excited just as if they were magically spontaneous, which is sort of this fantasy, right? Everything is just spontaneous.
And no, I do think there are some parallels, and we can talk, like sexual pleasure or even non-sexual pleasure, but being able to connect with your senses
Yeah.
and have the experience of seeing beautiful things and experience them and being visually stimulated and hearing beautiful things and having that be pleasurable and delightful and being outside and feeling the wind and the sun, and just in those moments really recognizing those as sensations and as enjoyable, and actually just kind of bookmarking them as such helps you remember and allows you to recall those times in the future. And you're more likely to either remember that things are good or better, and instead of always remember things being so bad, right? And also what we remember also predicts how we look forward to the future. And so it's easier to recall good times that we've had and experience those now. It's
Mm-hmm.
easier for us to access those experiences if we purposely make a note that this is enjoyable. I like this. This feels good. You just kind of take a moment, you take it all in. You're like, this is okay. This moment's a good one.
And I feel like it may have been you who taught me that this trick, that when we meditate on something and we think about those senses, the brain doesn't actually know if it's real or not, or if it's actually existing or not, if you're in a deep meditative state. And so I wonder too if you think that you can recreate that moment of play if you're really present when you are being mindful or breathing or meditating later on and reinforce those circuitries.
Absolutely, 100%. I think
I
again,
got it.
yeah, A plus. It's sort of like, and I think everybody can relate to this experience. It's like a song that you hear, and
Is
maybe
it
you
from
haven't
Paw
heard it.
Patrol?
No. It's
We're
a
just
summer
kidding. All I
song.
do is listen to
We have these
toddler
songs that
music.
are associated with like memorable times in our life, or memorable people in our life, or memorable experiences. And as soon as you hear it, you're almost transported, right?
Or like your grandmother's perfume.
Yes,
Yes.
smell, sound, all of those things. And you're sort of in this way, sort of instantly, kind of, at least for a moment, transported to that time. And so, yes, you're lighting up that circuitry and you're laying down like new connections. And you're kind of bringing that experience even into the present. And
Yeah.
so, remembering times that were happy and pleasurable and exciting is enough to kind of recreate, at least partially, like simulate that experience for your brain now.
Yeah.
That's good self-care. I mean, that's part of the practice. Yeah.
Yeah. Yeah. So, what do you tell someone who is self care challenged? If they're self care challenged, how do you get them to start?
Okay, so that's a good question. I'm glad that you asked. If you want to level up your self-care game, get your self-care game on point. So I have an acronym that I use to help people remember. Okay, what should I be doing? What are the basics? And some people have already got some of these down. And that's great. But we can do the advanced work if you'd like. So that the acronym to help people remember is, if you're looking for a healthy escape. Okay, and escape stands for exercise, sleep, connection, appreciate, pleasure, and exhale. So most people know that exercise is good for us, and that's probably a really good place to start if you're doing nothing else. Physical activity of any kind is good for us. Okay? We've become awfully sedentary. And I'm a pretty regular exerciser, and what I've realized over the past few months is that doing regular exercise is important, but it doesn't necessarily negate the negative consequences of being sedentary. But like, those are two
Mm-hmm.
different things. And so
Mm-hmm.
even in myself, I can notice that there's a difference, because I'm pretty active, but I've also become a lot more sedentary. And
Mm-hmm.
I can tell that that's having an impact. Maybe we can talk about that another time. But any sort of
Mm-hmm.
physical activity, movement every day should be
Mm-hmm.
something we strive.
Mm-hmm.
Sleep is the next one. And
Mm-hmm.
everybody's sleep needs vary, and you might have a sense of how many hours of sleep that you need, but you want to aim for quality over quantity. And really, it's about just making a routine around sleep, prioritizing sleep, and prioritizing rest. That's a really critical part of our health that we tend to overlook. We spend a third of our lives asleep. It's
Mm-hmm.
really important. We wouldn't do anything for a third of our lives if it wasn't critical to our health and survival.
Mm-hmm. Mm-hmm. I don't know. I love sleeping.
I, I I will tell you that for the first time in a long time, my sleep was pretty significantly disrupted
Mm.
during COVID, and especially in the beginning. And there was just a lot going on. And so I really had to like practice what I preach and like
Yeah.
employ a lot of, but,
Yeah.
and then the other one that was disrupted is connection.
Mm-hmm.
So connecting with people obviously has been a lot harder to do, or at least differently to do, but it's still really important. And there's lots of ways to connect. It doesn't always require connecting with another person. We can connect within. We can connect with ourselves. We
Mm-hmm.
can connect with nature. We connect with pets. We can connect with a cause, or we can connect with a community, and all of those things count. The point is to just feel connected to something.
I like that. I like that.
The next one is appreciate, which is gratitude, which we've spent some time talking about. So it's recognizing every day that things are, counting your blessings, being thankful, saying thank you, recognizing the good, and then also appreciating the lessons. I
Mm.
think that's a really also important part of gratitude practice. Then the P, of course, is pleasure, play, laughter. We talked about that. So doing something every day, or as often as possible, that you find enjoyable or delightful or interesting even. or engaging.
Mhm.
And then the last one is exhale, which is breathing, meditation, um, relaxation. And again, the key to all of those are all great. You don't have to do all of those every day. And there's a lot of activities that we can do that actually count. You know, you get more bang for your buck and you can check off several of those with one. And those are kind of fun to do. But it's really just that momentary recognition that I'm doing this for my self-care. I'm doing this for me. This is good for me. And um, yeah, and the attitude that you bring to it.
Yeah, I like that. So escape. I will put that in the. I really like the acronym. Right, that's the word I'm looking for. Wow.
So yeah, that's what I've been calling it. I hope that's what it is.
Yeah, I really do like that. So that you don't, you can kind of peel apart some of those layers and start if you're sort of new
Mm-hmm.
to self-care and sort of where to think about starting.
Yep.
As you were kind of going through this list, I was thinking about how I tried to develop a few new hobbies during this time, and one of which was gardening. And we're talking like I just planted herbs and I bought a tomato plant, which is pretty much self-sufficient, but I water it. And I think picking up a new hobby is interesting because, again, you're sort of lighting up a different part of your brain. You're maybe watching a YouTube video on how to grow basil or something like that. And I like the gardening thing because you can smell all the things and you're taking care of something. So I'm connecting with it. And so I was thinking about how maybe gardening has really checked off a lot of those things, even though I'm nowhere near a green thumb, but it's just sort of something new that I was able to do during this time.
Yeah, I don't think it requires us to be good at the thing that we're doing for
So
it
if
to
I kill
count.
all my plans, that's fine.
No, it's the journey, not the destination.
That's good
Yeah.
because the cilantro's dead, the basil's brown. It's
It,
just
well, and cooking is another one that cooking or baking, I think, is another one that I've seen a lot of people do or get back to, right? Which
mm-hmm.
kind of, again, is very similar. It's very creative and it can be very meditative and very, because if you kind of focus on that and you're creating something and you're putting like love into it and you can just make it into a thing that's much more enjoyable and something that we might have just sort of added to the list of things that we have to do. And I think the more things that we have to do that we also then want to do or get to do just changes the whole experience of that thing from
Mm-hmm.
something that we might have dreaded and not looked forward to something that we do. And
That's so
having to look
funny.
forward to is
Yes. I think
in short supply.
another example is I've been walking my dog. Now, this, let me just tell you, we used to just let my dog out in the fenced backyard, and we bought a very expensive fence that we could just put her out there and be lazy and not have to walk her. Then we quickly realized she had dug up the whole yard. So we spent a whole bunch of money to re-landscape it when, the pandemic just kind of started, so April or so. So I've been walking her every morning because she is not allowed to rip up the yard anymore. And it's also something that like it used to be this like, I just get a fence, right? But I really enjoy it. I go without my phone. I go early enough where it's not hot out. I see the neighbors. I hear the birds chirping. It's really nice. So it's also kind of like uh, bringing up something that used to be on my should list or have to do list, where is now part of myself. That's like my self-care
Yes.
is walking the dog.
Yes,
Yes.
that's it.
It doesn't
That's the
have to be
secret.
genius.
No, it could be the things that you're already doing. And
Mm-hmm.
it becomes a part of your self-care routine and your self-care practice because now you've totally changed that experience exactly from a chore or something that you have to do to something you actually enjoy and get something out of as well.
And I think that with things sort of slowing down, there is a ability to do that. If there's something good to come out of this, perhaps it is that slowing of things, maybe allowing you to rethink about the things that you
Mhm.
like to do. I feel like I'm in therapy. You're so good, Natalie.
No, I know you're so right. And the busyness of our lives, it came to a screeching halt, and it's sort of stayed pretty slow, which has been a difficult adjustment, I think, in some ways.
Mhm.
But I think in other ways, when you look at it that way, it really has allowed us to pause and think and take more time. We didn't have time. I mean, we were always rushing from one thing to the next, and we had to get here and we had to get there and had to do this. And it was just, there was no time. And so I do think that that's probably an upside, benefit.
Yeah, yeah. How do you think self-care might extend into the next couple of months where things really flip-flop a lot? Like, how do we keep up our self-care when the world around us, continues to have these big shifts? And are we going back to school? Are they not going back to school? Are we going to vote? Are we not going to vote? How do we keep our self-care up during all these things?
I think the self-care practices and building a routine helps create more stability. It creates routine, structure, stability, and predictability. And so even if all this stuff is sort of swirling around us and we're not sure where things are going to land yet, that's something over which we still have some control.
Mm.
And I think our need for control, or some level of perceived control over what we're doing and how we're doing it, is really important. So, and what I have people do is sort of pick something that's a non-negotiable, like either on that list or from another list or whatever. But like pick one thing that like you is just like a non-negotiable. Like you can't go without that, or you can't go without that for too long. And just make sure that you're like carving out time to do that, and treating that as a form of like medicine. Like
Medicine.
this is critical to my health, and I'm treating it as importantly as I would any other sort of treatment that's been prescribed.
Yeah, no, I absolutely agree. For me, it's exercise. I cannot go long enough without exercise. And I haven't found ways to be able to do that at home. I was actually
Mhm.
doing that anyways prior, but really kind of stepped up my game, and my husband as well, who used to go to the gym. And I do think when I think about times in my life, say residency, and I was really busy and I didn't exercise, how many downstream effects that had, like negative mental energy, negative self-talk, just feeling, you know, just
Mhm.
not like myself. Whereas where I've over the years really learned to accept that, I'm going to turn my pager off during this hour. And you know what? Nothing's ever happened. And I've probably been more productive than I ever was when I didn't do those things. So I
Mhm.
think for me is the ability to think about a time when I didn't put that on the list and compare it to a time when I did also made it seem really important, like a prescription, like a
Mhm.
medication. Like if you don't take this, there will be consequences to your health.
And exercise is a remedy for exhaustion. So I know that's not something we usually think about when we're tired, and we've been tired, and it's been confusing to people because like we're moving less. Why would I be so tired? And the reason why we're tired is because we're moving less. And so it
Mhm.
is, and it's critical for that reason as well. So the energy begets energy. If we want more energy, we need to move more.
Mhm. Really,
That's also another
really,
reason. Hmm.
really good point. You're absolutely right. I remember when this all started and my practice went to telemedicine, I was seeing less patients, but I was so tired. And it's because I just literally sat in this. I mean, you can see my commute to the
Right.
office. And I
Like
was
I
just,
used to joke about rolling out of bed, but like no, literally, like I roll into the office.
and you got your pajama pants on the bottom, and or maybe you
Go to
aren't.
work.
Yep, you go to work. And so, yeah, you're right. That's a very, very good point. And maybe a reason we're so tired is we're too slow.
Yeah,
That's a really good
too
point.
underactivated. We're too hypoactivated. And
Interesting.
then like anxious, and then our nervous system is on overdrive and being overactivated, especially in the beginning, but that can also lead to a lot of exhaustion too. And so I think just again, that's what I mean, taking care of ourselves is probably more important than ever.
Yeah. What kind of things do you like to do for play that is not anything we've already talked about?
Okay, so my remedy is laughing.
Uh-huh.
That's the thing that,
Oh.
so I like if I need a boost, like a feel good boost, like
Uh-huh.
quickly, I
Uh-huh.
laugh. So I've got comedians that I listen to on like the XM radio. I've got comedy shows that I like, and I
Yeah.
like a good belly laugh is like nothing to feel good. If you want to feel good fast, laugh.
Oh my gosh, you know what? That's so true. So I've been watching The Office. Have you ever watched that show? Oh my gosh, I've never seen it before in my entire life. And it is just so funny, and like their facial expressions, but like that that the humor from the show will last me several hours because it's just so funny. It's so ridiculous, you know?
I'll have to do that one.
Especially in contrasting to like today, where this show's a couple years old, and so there's lots of things you already couldn't say them. The Michael Scott, the main characters, shouldn't have already said them, but now it's just so insane that he would say these things. It's just so funny. You're right, laughter. I freaking love it. I love
Yep.
it. um I think this has been so helpful just to sit and hammer out and think about why self-care is really important, not just for your selfie on Instagram, right? It's not for
Mhm.
that. And also how we can think about even doing small doses every day, how we
Mhm.
can think about making the things that we already do just more enjoyable by just being present and actually seeing them as self-care as opposed to just this thing on my list. Thinking
Mhm.
about the escape: exercise, sleep, connections, appreciate, play, pleasure, and exhale. And I also loved the thing that you mentioned about connections not having to be, those connections with our friends or being together in a restaurant or at the theater like we used to, but maybe connecting with nature and our pets and ourselves, because there is not a lot that we do have control over, but certainly our daily regimens we can. And I kind of think to that point, not making it so regimented that it turns into and I have to, meditate, I have to,
Mhm.
get do my makeup. More
Yep.
of a, it should be something that makes you feel happy.
So the importance of self-care, and I think that was a beautiful summary. Well done. The importance of self-care for me is in the recognition that I'm worth the time and effort that it takes to do those things.
Mhm.
And that sends an important message. Our behavior sends important messages back to our brain about how we're doing. And we do those things. It reminds us that A, we're worth the time and effort that it takes to do it, and that we're doing okay. And I know it's pretty basic. I mean, people talk about self-care as pretty basic stuff, and these solutions are fairly simple, but I'm a big fan of simple solutions. We tend to make things more complicated than they need to be. And we live really complicated lives. So I think, simple is effective, and don't overlook the simple strategies too.
And what was your definition of self-care? Do the things that make you happy?
The things that you know are good for you.
Do the things that you know are good for you. Okay. Do the things that you know are good for you. I'm so thrilled that we got to take a moment and do this together and talk about self-care in a way that makes it, not so much of a selfish type of activity, but really more of a really cognitively um, helpful behavioral technique, right?
Yeah, it's like an attitude. It's almost more of less of an, I mean, it's an action, but it's also the attitude that you bring to it. Like this was self-care for me, just this conversation.
I know, it's so
It's
good
going to
because
go on my list.
I know, I feel like I haven't seen you in so long, and you're just such a joy to have in my life. So everyone for listening, this was us doing self-care right now. So if you're
Yes.
listening, maybe listening to my podcast is self-care,
Oh, look at that. Look at
right?
everybody self-caring right
Right
now.
now. You're welcome. No, I'm just kidding.
Everybody's self-care game just leveled up.
Yes. Well, I want to thank you so much for taking the time to come on the show again. And it's so nice to have a reoccurring guest and a reoccurring face. It's always a pleasure to hear and to think about these topics, not just from my own brain, but from a trained psychologist, because certainly it keeps us all in check, especially me, because I can definitely kind of come up with plenty of my own ideas, but it's nice to have someone kind of validate or give a broader explanation and a bigger reasoning for why these things are important. So thank you for being on the show today. If people want
Thank
to
you,
find
Heather.
you, where can they find you?
Well, you can find me on Instagram, Mental Fitness Doc. I do post some self-care stuff there, tips and tricks and other mental fitness kinds of things. Also on Twitter, but my clinic is at Brigham and Women's, and we have a website there too.
Perfect. I'm going to link all of your stuff below. So if anyone wants to find out more or follow you on social media, I definitely recommend it. You are such a great inspiration, certainly to me. So I know you will be to others as well. So thank you guys so much. Thanks everyone for listening in. I absolutely appreciate it from the bottom of my heart. It means the world to me. If you liked this episode, give it a star or some reviews, or let me know. I love your comments. That really does shape how I want to make these next episodes. So let me know, and I will see you guys again next week. Bye.